What if I told you that one day, instead of getting a dental implant, your body could grow a brand new tooth? It sounds almost too good to be true, doesn't it? Especially if you're over 40 or 60 and you've already experienced tooth loss, dentures, or surgery. You may have heard that researchers in Japan are testing tooth regeneration treatments. And naturally, the first question that comes to mind is not how amazing, but is it safe? What about side effects? Today, let's talk honestly. No hype, no fear, just calm, clear truth. Tooth regeneration is a new type of treatment being researched by scientists, including teams at Kyoto University. The idea is simple in concept, even though the science behind it is complex. When we were children, our adult teeth grew naturally from tiny tooth buds hidden in our gums. Scientists are studying ways to reactivate similar natural processes using special cells, often called stem cells, that have the ability to develop into different types of tissue. In very simple terms, the goal is to encourage your body to grow a real, natural tooth again. But here's the important part. This treatment is still experimental. It is being tested in controlled clinical trials. It is not widely available at regular dental clinics. If someone tells you they can regrow your tooth today in a standard office, that is not accurate. Now, let's address the real concerns. Many people are worried about safety, and honestly, those worries are completely understandable. One major fear is cancer. People hear the word stem cells and immediately think about uncontrolled cell growth. Another fear is mutation. What if the cells grow the wrong way? Some people worry about jaw damage. Others wonder about long-term effects. What happens 10 or 20 years later? Will there be hidden problems? These are smart questions, and researchers are asking the same ones. So far, in early studies and laboratory research, scientists have been very careful. The type of approach being studied in Japan does not simply inject random stem cells into the body. Instead, it targets very specific biological signals that guide tooth development. In early animal studies, new tooth structures formed in a controlled way. That is promising. But animal studies are not the same as long-term human results. That's why clinical trials are happening slowly and carefully. Now, let's talk about possible side effects, honestly. Short-term effects, based on similar regenerative procedures, could include swelling in the gums, mild inflammation, tenderness, or temporary sensitivity. These are common reactions whenever the body is stimulated to heal or grow tissue. They are usually manageable and temporary. Long-term effects are still being studied, and this is where we must be realistic. Because this treatment is new, we do not yet have 20-year data. We cannot say with 100% certainty what happens decades later. That doesn't mean it is dangerous. It simply means research takes time. When you hear about studies connected to Kyoto University, remember that universities move carefully. They are not rushing treatments to the public. They test, observe, measure, and recheck results. Safety is the first priority. Now, many of you might be wondering, how does this compare to dental implants? Dental implants have been used for decades. They involve surgery. A titanium post is placed into the jawbone. For many patients, implants are very successful. But surgery always carries some risk. With implants, possible complications include infection, nerve irritation, sinus issues in upper jaw cases, and bone loss around the implant over time. Some people also fear surgery itself, the cutting, the drilling, the healing period. Tooth regeneration, if proven successful, may reduce the need for artificial materials and invasive surgery. In theory, growing your own natural tooth could mean better integration with your jawbone and less long-term bone loss. A natural tooth also has tiny ligaments that implants do not have, which help with natural movement and shock absorption. However, we must remember something very important. Implants are well studied and predictable today. Tooth regeneration is promising but still under investigation. So, is regeneration safer than implants right now? Today, implants are the safer known option because they are proven. In the future, regeneration may become even safer, but we are not there yet. Now, who should be especially cautious? Patients with a history of cancer should be very careful with any treatment involving cell growth stimulation. People with weakened immune systems may also need extra evaluation. Very elderly patients, especially those with multiple medical conditions, would need careful screening before participating in trials. Researchers are not ignoring these groups. In fact, clinical trials often exclude higher risk patients at first, precisely to protect them. So, what are doctors saying right now? Most responsible dentists and medical researchers are cautiously optimistic. That means hopeful, but not rushing. Clinical trials can take many years. Why? Because doctors must observe not only whether a tooth grows, but whether it stays healthy, stable, and safe long term. Medicine moves slowly for a reason. It protects patients. As a dental professional speaking to you calmly and honestly, here is my verdict. Is tooth regeneration completely proven safe today? No. It is still under research. Is there strong scientific promise? Yes. Is it science fiction? Absolutely not. Real laboratories are working on this. Real clinical trials are being conducted in Japan, and the early signals are encouraging. But we must separate excitement from evidence. For adults over 40 and seniors who fear dental surgery, this research represents hope, especially for those who cannot tolerate implants or extensive procedures. But until larger human trials are completed, traditional treatments remain the standard, and that is okay. The future of dentistry is moving toward more natural, less invasive solutions. Regrowing a tooth instead of replacing it with metal is a powerful idea, but safety always comes first. So now I'd like to ask you something. If tooth regeneration becomes fully approved and proven safe, would you try it? Or would you prefer to stick with traditional implants and dentures? Share your thoughts in the comments. I truly want to know how you feel, especially if you are over 50 or 60 and have experienced tooth loss yourself. And if you have friends or family members who are worried about dental surgery, send this video to them. Let's replace fear with knowledge and make decisions calmly, together. Because when it comes to your health, you deserve honesty, not hype.